My name is Mackenzie Robeson, and I am a psychology trainee in the doctoral program at the University of South Alabama. I'm pleased to present my work entitled What's in a Day? Investigating the relationship between sleep quality and quality of life among caregivers of children with autism. Caregivers of autistic children often report poor sleep quality as a result of their child's elevated sleep problems. And these caregivers also tend to demonstrate lower quality of life compared to the general adult population. However, the relationship between sleep quality and ratings of quality of life is not currently understood on the daily level for these caregivers. And further, this relationship is not likely a one-to-one association. So there are a number of factors that could be at play in this relationship. Caregivers of children with ASD often report lower levels of positive mood and higher levels of negative mood when caregiving. They also tend to report sleep disturbances, which are linked with risk for physical health problems. Therefore, sleep quality may impact quality of life through caregivers' daily mood and physical health. This study aimed to determine the daily factors that might explain the relationship between sleep quality and quality of life in caregivers of children with autism at the daily level, specifically looking at caregiver mood and physical health as mediators. Mobile Ecological Momentary Assessment, or MEMA, was used to capture daily experiences. In this assessment, caregivers received notifications on their phones throughout the day, where they had 20 minutes or so to complete a series of questions, capturing a number of variables to understand their experiences at the daily level. 51 caregivers of children with ASD did participate in this study. After a baseline, data was collected for a period of 2 weeks in which they received 4 signal contingent prompts at random times throughout the day, and then 2 time contingent prompts, one at the beginning and one at the end of their day. For this study, mood was measured using the signal contingent prompts, so mood was tracked up to 4 times daily. Mood was only one item, and they could select from 7 options, which were then coded into positive or negative mood. Sleep quality, physical health, and quality of life were assessed using time contingent prompts, with sleep quality sent at the beginning of the day and physical health and quality of life sent at the end of the day. Sleep quality and physical health were both assessed using one item each, whereas quality of life was measured using 5 items, which were then summed to create a score. To analyze this data, correlations were run to be sure that these variables were related. And then with established relationships, a 2-level model was specified to measure between subject variation nested within individuals. And then mediation analyses were run through a macro for SPSS that was made for this kind of model structure. So there were significant relationships between variables. In regression analyses, sleep quality was significantly associated with quality of life. Between individuals, sleep quality was positively associated with quality of life. But surprisingly, within individuals, sleep quality was negatively associated with quality of life, such that participants who rated their sleep quality to be lower than their average reported higher quality of life. The first mediation model looked at whether between and within mood mediated the relationship between within and between person sleep quality and quality of life. And results did reveal a significant indirect effect of between person mood. A second mediation model was estimated to determine whether between and within person physical health mediated the relationship between and within person sleep quality and quality of life. And results did show that there were significant indirect effects of between and within person physical health. So between individuals, sleep quality was positively associated with quality of life, but within individuals, poor sleep quality led to better ratings of quality of life compared to their average rating. So outside factors must moderate this relationship between sleep quality and quality of life, such as social support or child factors like socialization or play. So clearly, further research on potential moderators is needed to clarify these findings. But mood and physical health did appear to mediate this relation between sleep quality and quality of life. Data collection was self-report, and variables were assessed using few items, which may not fully capture a construct. But this did make the study more feasible for gathering ecological data and allowed for better access to these daily experiences. So despite these limitations, the study contributed to an important gap in the literature, where we were able to gain insight into daily experiences of caregivers of children with autism. And understanding these factors allow us as clinicians to better target these areas in treatment to improve outcomes.